Hi, my name is Amy and I am an occupational therapist with the OT service and within the NHS. The month of April hosts both Parkinson's Awareness Week and MS Awareness Week, so I wanted to take this opportunity to have a discussion about bathing with a particular focus on people with neurological conditions. As occupational therapists, our role is to promote health and well-being through meaningful occupation, and we do this in a client-centered and holistic way. When it comes to bathing, particularly within statutory services, this can be somewhat challenging because we often feel like we can only order equipment that is available to us at our local equipment store, or what we are told we are able to access based on a person's physical function. The difficulty with this is that it purely focuses on how somebody gets in and out of a bath or shower. What it doesn't do is look at the reason why people might bathe. It doesn't look at the reason why this might be meaningful to them. Every person I know has a bath in their house, and they use it for a variety of reasons. It may be to bath their kids as part of a bedtime routine, to warm themselves up if they get cold, or just to relax at the end of a stressful day. If we all get the choice between a bath or a shower, depending on what we want to use it for day to day, then so should people with illness, injury, or disability. People with neurological conditions have a whole range of symptoms and difficulties which can fluctuate day to day and significantly deteriorate over time. So if we think of symptoms like pain, stiffness, contractures, temperature regulation difficulties, or sensory changes, for example, there is evidence to support that immersion in warm water can have a positive impact. It can reduce pain and stiffness. It can support the body to move more freely in the water. It can allow the muscles to relax and stretch more easily. It can help to regulate the body temperature, and it can be a lot less painful on the skin than showering. So someone with quite significant physical difficulties could really benefit from having a bath prior to their physiotherapy or prior to a stretching regime, or in order to help gain a better position for their hand before splinting. We know that people with neurological conditions have been shown to have the lowest health-related quality of life of all the long-term conditions. And it's common for them to have reported difficulties with sleep, low mood, and anxiety, all of which can be improved by having a bath. The other area that I would like to consider with regards to this client group is their carers. Particularly as conditions deteriorate and people become less physically able, the demands on carers increases, and supporting the health and well-being of carers is a very important role for occupational therapy. If you imagine, for example, somebody with quite complex physical needs, they may be non-weight bearing, may have limited trunk stability, have limited arm and leg movement. As a carer, this can be really challenging. They might have a level access shower and a shower chair, and as a carer, you are trying to maintain someone's personal hygiene, which involves a lot of bending and reaching and twisting and trying to maneuver a sometimes quite heavy shower chair in a quite small space, while also trying to keep that person under the water so that they stay warm. Historically, we didn't have many options when it came to bathing. The more someone struggles with getting in and out of a bath, the more likely they are to get offered a level access shower. And if someone's reason for accessing a bath or shower is purely to get washed, then a level access shower can be a really good option. But we now have alternate bathing solutions which enable people with complex conditions to be able to access a bath if that's what they choose to do. Baths can be height adjustable, thermostatically controlled. They can have built-in platforms which can reduce the number of transfers needed, while also allowing you to remove somebody from the water quickly if that's what is required. There are a number of postural supports available to make sure that someone is as comfortable as possible within the bath. And a bath also allows a person and their carer to have direct eye contact and communication, which can be very important. The current legislation supports provision of a bath or shower or both if required, and considering provision of an adapted bath allows occupational therapists to maintain their client-centered holistic approach while ensuring that the focus remains on meaningful occupation. Please take a look at the Abacus Academy website for some really good bite-sized CPD videos related to bathing. And thank you very much for your time.